Chairman. And today we have referred to, people on the panel, people up here, have referred to Nurse 1 and Nurse 2. And these are two young women that have dedicated their lives to helping other people, sick people. And to refer to them as Nurse 1 and Nurse 2 just doesn't set well with me. It's kind of reminiscent of Dr. Seuss, Thing 1 and Thing 2. These are not things. So for the record, I'd like to state that the first nurse to contract Ebola was Nina Pham. And the second nurse was Amber Joy Vinson. These are young women with families. I know one in particular has a fiance. And so I think that it would serve us well to remember that these are human beings that have dedicated, young women that have dedicated their lives to helping other people. And for them and nurses everywhere in their family, I'd just like to open with that. Dr. Frieden, you said in your testimony earlier that only by direct contact can you contract Ebola. Do you stand by that statement?
Direct contact with someone who's ill or died from Ebola or their body fluids.
And it's not airborne. Congressman Matheson just said, and you agreed it's not an airborne, cannot be contracted airborne.
Ebola spreads person to person, not by the airborne route. So it's not like...
So you need personal contact.
Yes.
If you need personal contact with bodily fluids, why is there an airliner in the Denver airport right now that Frontier Airlines has scrubbed 4 times? Aren't they wasting money? Why can't they get that back in its service? If you have to have bodily contact, close contact, why scrub that airliner?
I understand that people are very concerned about Ebola. It's a scary disease. I can't comment on what exactly the airlines do. So it's just for public perception. I mean, they really don't need to be doing that, right? We have detailed guidelines along with the EPA for how to clean airlines.
Do you need a fever to be contagious?
You need to be sick. Generally, the first symptom of illness is fever.
So do you need a fever to be contagious?
Late in the disease, when people are deathly ill, they may not have fever, but they would be unlikely to be able to walk at that point.
This 21-day period that you need to show symptoms within 21 days from exposure, during that could you be contagious at the 3rd day of that point?
Only if you were sick, only if you had symptoms.
Okay. And the incubation period is anywhere from 0 to 21 days?
2 to 21 days, generally within the first 10 days or so.
You said here today that there's 100 to 150 people a day coming from West Africa into the United States. You're opposed to travel restrictions, which the constituents in the 7th District in Missouri are very much in favor of travel restrictions. I predict you're going to put on, or the President's going to put on, travel restrictions. I don't know if it's going to be today or tomorrow or 2 weeks or a month from now, but I think that they're coming, and I think sooner rather than later. If there's 150 a day and you rationalize, well, we don't really need to worry about that because they could get cross borders, they could go by land and then get here. If that 100 and 150 a day, don't you think that number might be reduced to 5 or 10 a day if we did put on travel restrictions?
I can't comment on what numbers would...
If someone had to make an effort other than going out to their local airport and jumping on a plane, if they really had to try to get here, don't you think that number would dramatically drop?
I know that people do come back, and right now we're able to screen them, collect their information.
What if they don't come back? A lot of people come in this country and we lose track of them. They don't come back. What happens then? My point is, if you got 150 a day coming in or you have 5 coming in a day, I and my constituents would rather have 5 a day coming in. And this thing of checking for temperatures like it's going to help is kind of like scrubbing a plane that doesn't need to be scrubbed. But I'd like to commend the folks reading this copy of Bloomberg Business Week. Ebola is coming to America. The U.S. had a chance to stop the virus in its tracks, but it missed. That issue came out before Mr. Duncan came to this country and before he was diagnosed with Ebola. There's some good reading in there that I would recommend. I'd also recommend, too, if you want to Google, a hospital from hell is swamped by Ebola. The New York Times, just a few days ago. Hospital from hell. If you get a chance to read that, I think that everyone would be in favor of the travel restrictions we've talked about here today. And today, OSHA, Occupational Safety and Health Administration, just today said that Customs and Border Patrol immigration enforcement agents are at risk of coming into contact with Ebola. Mr. Wagner, are we prepared for that? Are your agents, are they protected to the fullest extent what they need? This just came out today.
We issue them personal protective gear, and we train them on how to wear it and what circumstances to wear it. But they encounter all different kinds of travelers with a whole host of different potential communicable diseases. So, you know, we are aware and we do train to recognize signs of over illness, and then we have the protocols with the health professionals to get those travelers into that care and to protect our employees.
To me, they fall in the same category the nurses. They're there to save us and help people and protect people in this country. So God bless them. I yield back.
Gentleman's time.